Hi, everybody. I'm Jodi Carlton, and welcome again to another episode of Spectrum Strength Talk. Today, I have Dr. Linda McCormick, who is a pediatrician with Tanner Healthcare System, and I've known Linda for several years, and I've asked her to come and talk to us today about some of what she's seeing with this coronavirus epidemic. And autism is also dear to her heart, and she and I've known each other. We actually met through our mutual love of music. We were in a musical chorale community chorus together several years ago. And Linda has been practicing in the West Georgia area in Carrollton since 1991. And so anyway, I wanted to just have a conversation with her today about how, what kind of thoughts that she has about how this is affecting the autism community, and from just a perspective of a pediatrician. So welcome, Linda. Thank you so much for joining us here, joining me, talking to me. Thank you. And I'm just going to turn it over to you and just ask you, what are you seeing? You're on the front lines out there for the pediatric community.
Well, first of all, thank you for having me. I really appreciate the invitation, and it's really nice to see you again.
You too.
We have had, a lot of children, both on the spectrum and not on the spectrum, come through our office with questions about coronavirus. And I think some of the most important things that people are wanting to know from me is, how do I handle my children during this period of time, during this period of isolation at home? What kind of things can I do? What they really are more interested in physical and mental health of their children, more than they are worried about their child catching the illness. I think a lot of people know the symptoms now, certainly, and everybody knows how to prevent them. I can certainly go over that again real quick, just for those who might need a refresher. But helpful hints on the area of not getting sick and what to watch for is to, avoid sick people, avoid touching your face, eyes, nose, mouth. That is difficult with children on the spectrum. So they need gentle reminders not to touch their face. Of course, cover your cough with a tissue, or your elbow. If you don't have a tissue, throw it away. And then wash your hands right afterwards. It's actually recommended, although a lot of people have hand sanitizer, it's recommended to use soap and water first. That's the thing that's recommended first. And that you should wash for 20 seconds, which means sing happy birthday at a normal pace twice.
Right. And that's hard to do.
That's hard to do. That'll get the 20 seconds. The second choice would be a 60% alcohol-based hand sanitizer. But if your child does, come up with the symptoms, which are fever, cough, and shortness of breath, many of those symptoms are going along right now with normal colds and flu, and some of the allergy symptoms that we're seeing as well. So it can be confusing. But if you think your child may be infected, the best thing is to isolate him or her, reassure them that they're going to be fine. Probably not go to your doctor's office if they're not severe. Call. There are many resources that we have right now. In fact, at Tanner, we're having a drive-through testing where you can call your pediatrician's office and say, I really think my child needs to be tested. And they can actually give you an appointment time to just go and drive through the portico at the hospital, and the nurse will do a nasal swab and have the results within 24 to 48 hours. But I would also warn people to be careful of that, because we don't want to use up valuable resources for children who just may have a simple cold. And most children get over this without any problems.
Yeah, and that's a good point. And so I wanted to ask you for some guidance for some of these parents, because a question came up yesterday in a forum that I'm in of women who are married to men on the spectrum, and so many of them actually have children on the spectrum too because of that genetic link. And
Right.
And so I'm a moderator in that group, and so another woman in the group is a nurse, and we were talking about a woman who has a young, very young child who's showing some really pretty significant symptoms, high fever, cough, and the child had been a preemie, and I think it's a toddler. She had been in touch with her pediatrician, and it's a pretty rural area, and the pediatrician was advising them to just treat it at home. But the mom just wasn't really sure if she should take that further, if she should go into a hospital. And so what kind of advice do you have for parents who have children? Because a lot of children on the spectrum, especially when they're younger, sometimes have other health issues. They have the asthmas and lots of other stuff going on. Sometimes, what do you advise to parents when they want to follow the guidelines, but they're not sure what to do?
Well, I would say that, some people need reassurance, and they really need that testing for the reassurance. But I think in some cases that can even be more anxiety provoking if you know that your child is positive for this. There really haven't been that many positives. All the ones that have been tested at Children's Healthcare of Atlanta, for example, only 1% of all the tests done were positive. So I would still say to try as much as possible to reassure the parent that just self-isolation and treating the symptoms at home is really all we can do anyway. So knowing that it's COVID-19 versus not knowing, it really doesn't, it doesn't make a big difference.
Right. And so it really doesn't come down to whether it's COVID-19 or not. It comes down to whether or not the child needs medical attention.
Needs to be seen, no matter what it is, because it's actually more likely to be the flu right now. Right. We have many more cases of the flu than we do. And a lot of the respiratory panels can test for the flu as well as other respiratory illnesses too. But it is expensive. The testing is expensive, to the general public, and we're going to run out of resources. So yes, it's true that I think just reassurance and just treating the symptoms, because no matter what it was, whether it was a common cold or something more serious, you would treat that child's underlying symptoms. You would treat the asthma symptoms. It is important to call your doctor because, for example, some children with asthma are treated with steroids that actually makes the coronavirus worse.
Oh, really? Okay.
It can suppress it suppresses the immune system, and it can make you worse because you really need all of your immunoglobulins, there to fight off the virus. So if your child has asthma as well, in the case of this preemie who may have had some respiratory issues, it's important to follow the protocol for 6 days on your asthma treatment plan. If that includes an inhaled steroid, that's fine, and a beta agonist like albuterol or something. But as far as oral steroids, unless it was just very severe, it's recommended that you try to avoid those.
That's actually really good to know, because I think so many parents have been, on the front lines with their kids for so long and treating asthma related issues or other types of respiratory things for so long. And they've got the nebulizers at home, and their kids have been dealing with these types of things that parents may try to figure this out on their own. And so what you're saying is talk to your doctor, because those are the types of things we don't know. We don't know that steroids can make COVID worse. We do need to just call our doctors, follow the protocols. And if our children seem to be getting worse and seem to be in distress, call the doctor back.
Right. And then you would possibly need an office visit. But every office, ours included, is taking precautions to just have a dedicated room or a couple of rooms that they only see those patients that, are possibly infected with coronavirus. And it's important to let the child know too, if you do plan a trip to the doctor, that it's very likely that the doctor will come in with a special gown, a mask, because we have to wear an N95 respirator mask. Makes you look, it's a big one that covers. I should have brought it with me and show you, but it's a big one. and goggles too. So I hate to
that's
scare
so
children.
yes, let's talk about that. Yeah,
that's going to happen.
I'm so glad you brought that up, Linda. Let's talk about that, because social scripting is so important for autistic kids, and knowing how to preparing them for what's going to happen is super important. So let's talk a little bit more about that. So you're saying that when a kid comes in to see you, regardless of why right now, whether they come to see you in the office or they have to go to the emergency room, these doctors, do you think it's best, and I'm thinking through this as a therapist too, do we show them a picture? I think maybe we show them a picture of what we're
Sure. Yes.
these doctors on TV.
Mm-hmm. Yeah. I mean, there's
gowns and everything.
Yeah, there's a lot of pictures, there's a lot of pictures everywhere. In fact, Tanner Health Systems on their website actually has pictures of people all gowned up, holding signs that say, "Please stay home."
Right, I've seen
So,
that.
and those, they look happy, they're looking happy. So, you could go somewhere like that and find a picture of a doctor or a nurse with a head covering, goggles, a mask, a gown, to know ahead of time what you're going to be seeing when you get there. And also to let the child know that, they may or may not, but they might get something stuck up their nose, to have a test to see if they have this virus. But you can reassure them that there's no shot for this. So they're not going to get a shot.
Yeah.
Some of them are scared about that. Neurotypical children and children on the spectrum are afraid that they're going to go up and get a shot. But to warn them that they may, if they're used to going to their doctor's office, they may have to go in a different entrance, that they probably won't sit in the waiting room. They might be asked to sit in their car and receive a phone call when it's their time to come up. So that would be different from what their normal office visit would be.
Right.
So letting them know that that's going to be probably the protocol, and that they'll go right to the exam room. They won't go to a weighing station or something like that, depending on, they won't be triaged first. They'll go straight in there, and probably only the doctor will come and see them. That's how we're doing it at our clinic now, just to keep those people who could possibly be infected with the virus in one location.
Okay, that is really helpful, because that would be a major change, a major difference for a kid on the spectrum who's used to a different script, and a different routine, a different script, and that could throw them off completely and be very shocking for them.
Right. So telling them that.
Yeah, guys, Dr. McCormick used to be my kid's pediatrician several years ago before we moved away. And I can remember she put them at ease at many times. As a matter of fact, she did have to give both of my kids a shot a couple times. And I think my daughter passed out in her office one time after a prednisone shot. But I remember you being very good at putting them at ease, just telling them, prepping them for what's coming. Do you have, are there things you're saying to them as you're coming into the room with this big gear? Did you have, what are your strategies right now that you're using with these kids to help them feel more comfortable?
Well, usually what I do is I come in at first, just with my lab coat, and I usually we have to wear like a plastic gown over it. But as I walk in the door, I normally have the mask down, the goggles up, because I'm far away from them as I walk in the door. And I say, I have to put this on. I have to put this mask on. It's going to look really funny. And I have to put these glasses on that they're going to look kind of funny too. But it's not anything scary. It's just to help protect me so that I can take care of other children too, and to help protect you if I have any germs. So I think the biggest thing is, being open and honest with the children, even the ones who aren't coming into the office, because they're seeing a lot of things. And I know this is a little bit of a different tangent, but I did want to kind of impress upon everyone the fact that, and they probably know if they have, older kids on the spectrum, kids that are higher functioning, there's a lot of anxiety about this in general. So I think keeping some of the, television watching and media and all that to a minimum, and just answering their questions honestly, find out what they know first and confirm it or you know, deny that. And just, you know, recognizing that their worries are true, like we worry about anything, but they can choose what they put in their brains. They can choose what to think about. So, you know, when it comes to whether it's anxiety about going to the doctor's office, anxiety about I might get this, or anxiety about a parent maybe who works in the healthcare field or something like that, that they may be worried that they're going to get it. They may be worried about their parent. I think confirming their feelings, recognizing their feelings, and validating it, but then saying, you know, you don't need to worry about this any more than you need to worry about other things. And,
right.
and as well as the physical health of the child, if that anxiety becomes overwhelming, you know, there are, you know, you do need to call your doctor and perhaps talk about strategies, not just mental health strategies like talking to someone like you, or you know, using some breathing techniques or yoga or other calming techniques. But, you know, some of those children may actually need to be treated with medication for a short period of time. And that would be something that your healthcare provider could answer for you.
Right. And that's a really good point that, you know, I did another episode of this with Dr. Robert Jason Grant and Danielle Weems. I don't know if you know her. She's an LCSW in Carrollton. And so we did an episode of this about how to cope with this at home and strategies for coping. And we reminded folks that we mental health professionals are also still out there to help support, and everybody's moving over to telehealth in our field too. But it's a good point that you bring up as well about medication, because there are, you know, temporary anxiety meds. It doesn't mean that your kids are going to be on meds for the rest of their life.
Right.
There are a lot of adults right now even that are saying I need something then for, you know, temporary right now to get me through this. And that's something that honestly I hadn't thought of until you just brought that up. We all just kind of have to figure out how to get through this on a temporary basis. But it's important to know that we don't have to just, there are resources, and we can get through this. And going back to what you were saying about what to share with them, that's something that I think it's important that we talked about this in that other video cast. It's important to know your child and how much your child can handle, because we are in the middle of a different kind of war zone, if you will, with this pandemic. And it's important for a lot of our kids to know what's going on, but you have to really kind of know your kid and know how much they can handle, and help them to know why it's important that we're quarantining, why it's important that we're washing our hands and we're being safe. And some of them are going to have family members that are high risk that may end up in the hospital. And some of them, unfortunately, may have family members that pass away, hopefully not. But those are difficult conversations depending on the capacity of our children that we're having to have. And I think it's just important for parents to really take into consideration what their children can handle.
Exactly. I agree with you. And I think, and I don't know if you talked about it in previous video casts too, how important it is to keep to as normal a schedule as you can at home, just on a regular basis. Did you all cover that with your previous podcast?
We can cover anything else here again, because people that are watching this one probably haven't seen that one. So
yeah, well,
about it again.
there was another thing I was thinking about. I mean, besides just talking to your children, knowing your children, knowing what they can handle, how much information they can handle, depending on their level of understanding or functioning. But I think that people need to realize how it's very easy to just say, okay, it's vacation and let's just sit around on the couch and watch videos all day. It's really tempting to do. It's actually harder to do what you should be doing. And that is, keep to a regular schedule of sleep, get up at the same time, just like you would if you were going to school, go to bed at the same time. If your child takes naps, meals and time for schoolwork, whether they go to school or are homeschooled, just keep the routine that's pretty much the same as what you were doing before. But it's important to build in outdoor recreation as well when the weather permits. There's not a whole lot you can do. I know that my nephew is autistic and very, he's older, he's in his 20s, but he really, and he's not a higher functioning, he's in the, maybe a toddler stage from a mental capacity. And his favorite things to do are to go to the grocery store and walk around, and to go to the pool at the YMCA and to swim, those kinds of things. All of his favorite, go to museums, all of his favorite activities,
oh, wow.
they're gone. So, so we've, my sister has had to be very creative and come up with other things. So lots of going on walks, lots of crafts at home, some things that he can do. He's in an adult program now, but they do a lot of crafts. So she's trying to replicate some of those things, puzzles, things like that. And then they do have, as you probably know, they have virtual classes on just about anything. Some of the local YMCAs have virtual classes. Most of the gyms do, on this very platform that we're on right now, the Zoom or some other platform. So you can participate in those things
right, and
too.
I think on one of the other videos we talked about some of the museums even will let you do virtual tours, virtual walkthroughs.
Yeah.
But back to what you were saying about the schedule, yes, it is. You're so right that when you are at home, it is much harder to keep a schedule and a routine. My daughter, Abby, as you know, is on the spectrum. She has Asperger's. And before this pandemic even hit, she was taking an online class in high school. And she was already having difficulty with that executive functioning organizational piece of managing her routine, because she didn't have that structure in place of going to a class. And so now her whole high school experience is at home, and it's been quite an adjustment for her. My son is 13 and not on the spectrum, and he's managing it better. But as a parent, I've had to do what you said and implement even more of a structure than we had before, where they're getting up at certain times, TV goes off at a certain time,
right?
Screens go off at a certain time, everybody goes to bed at a certain time.
Exactly.
We can actually, there's a silver lining in some of this, because we're having dinner as a family every night now, whereas before we're at baseball and we're at we're scattered to the four winds. But that is really super important, especially, well, for all families, I think, but especially for these families with kids on the spectrum, because they don't have, now that we're just all stuck in the house, they don't have the actual movement transition. They're not moving from place to place, which gives that hard line of a transition. I'm going to school now, I'm going to my day program, or I'm going to the YMCA. So you literally have to put some kind of structure, where if you use a visual storyboard on a whiteboard, or something that shows this, then this, then this, then this, it can really, really help them visually break their day up. I think that's super important.
And that's what I recommend. Write down a schedule, exactly what you would do. And, and with the family dinner thing, I've always thought that was important for every family. But you can also use that as one of your activities. I've talked to some families who said, we're making dinner together. We're trying out new recipes. This is the silver lining that you're talking about. And many children on the spectrum can help, crack an egg or do something, or stir, or whatever, or any kid can. And then, they have that pride in creating something, and then you can sit down as a family and eat dinner. And that's a really good activity that we sometimes have to rush through on a typical day. And
I
so
told
now
Abby,
we
I
can
said,
take
you're
some
finally
time.
gonna, yeah, I said, Abby, you're finally gonna learn how to cook.
Yeah, that's right.
We're
You
all
can take
here
take
and we
some
got
time.
nothing else to do. So you're gonna learn how to cook now, kid, because she's 17 now and heading off to college here soon. So I'm like,
Yeah, it's a
we
good time to learn to cook.
right. So, and I think that's the silver lining. I think that's the other piece of this, that it's important for us to, another mom, I think it was on Facebook. I can't remember where this was. Somebody said this to me. She said, I hate to say it, but she almost felt guilty for recognizing the positive in this. And I said, you know what? It's okay. It's okay.
Yeah.
This is a horrible situation that we're all in, but it's okay for us to recognize the positive that's happening in our lives.
Oh, sure.
As a matter of fact, we need to embrace the positive. We need to embrace, because that's going to give us hope, and that's going to give us the ability to get through this, to embrace every ounce of positive that we can get out of this. And so if that, whatever those positives are, sit down and list them with your family. What are the benefits of us being stuck together at home as a family all the time? Because we're all painfully aware of the negatives of it. So let's list out the positives and say, this part is really great about this.
Yeah. Oh, my neighbors are out walking like they never have been before. And it's wonderful. I've seen neighbors that I didn't realize even were in my neighborhood walking by, lots of people out, keeping a safe distance, of course, but it's a positive thing. When the weather has been nice, everybody's outside. And so it certainly is a positive thing. And I will say, a lot of the people we've actually given some information. My husband is a high school teacher, and he's had to learn to do some virtual teaching. It's been hard for him, but like you were talking about, some of the things that you can do to entertain yourself and to source the museums and things like that. He has shared, and you may already know about this, the GeorgiaAquarium.org. You just go to there. They have an ocean webcam, and so they have cameras live feed on most of the exhibits. And many children, I've shown them in the office, and they have just been mesmerized and love that. And you can't go, and there is a mentalfloss.com. You may know of that website. They have virtual tours of museums. So if people wanted to, can give you those resources later, or here live if people want to write them down. But there's several resources for those kinds of things, or you can find some positive things to do if it starts raining and you can't get outside and do things as a family.
Yeah, if you would just text or email me anything that you've got, I'll just drop it in the description for the video cast. So I'll have that available for everybody. Well, is there anything else that you feel is pertinent that you want to add to anything else you want to share with our folks here?
Well, I guess the only thing I would say is to, again, just be as positive as you can. Everybody's scared. So, but, you can admit to your child that, yes, you're concerned too, but that, we've gotten through things before. And I know that families with children on the spectrum have faced many challenges and have gotten over them. And this is one that we will get over too. The only thing is, I think one question for a lot of people is when, and we don't know when. None of us know when. So I think we just have to honestly say, I don't know, but we'll get through it. And, it probably won't be too much longer.
I think that is one of the hardest things about this for autism spectrum folks, because the not knowing when, the open-endedness, is a very difficult thing for folks on the spectrum. They need to know when something's going to, that's a question that I get from Abby all the time. Even my 17-year-old, she wants to know, when are you going to be home? When are we going to this? When is, and I hear that from everybody I've ever worked with on the spectrum. They need to know that that's that structure that they need. And
right.
It's if there's any way that we can chunk it for them, and I don't even know how we can, because we really don't know. But and that's just something that we have to fall back on, I think, is to teach them how to deal with the discomfort of not knowing. And that's a coping mechanism that our children, our spectrum children, our non-spectrum children, and even ourselves, we have to learn how to deal with the discomfort of not knowing. And that's just kind of where it is.
Yeah. And you can say it's probably going to be summertime, just like cold and flu season. This is a virus too that will probably go away when the weather gets warmer. So at least there's that.
Right.
But none of us are for sure.
But we don't know.
But we don't know. We don't know.
All right. Well, thank you so much, Linda. If you ever want to chat again, just, definitely let me know. I'm always happy to talk to you.
It was great talking to you today.
All right. Thanks so much.
Bye.
Bye-bye. Hey folks, if you're still watching, I just wanted to let you know that if you need some support, that I've opened up my calendar for you guys. Normally I have a 4 or 8 week type coaching program for adults and couples in autism spectrum relationships, but I've suspended all those programs right now, opened up my calendar for single coaching calls for those of you who just need to reach out and have someone to talk to. I get it. I get where you are. So I've got some 30-minute and 1-hour coaching calls available to you. I'm going to drop the link here in this video so that you can schedule an appointment with me. I'm set up to talk to you on the phone or on video nationwide here in the U.S. So if you need some help, you need some support, just reach out and we'll chat soon. Hope you guys are all staying well.